All right, I'll get started. Thank you, Kevin.
Uh-huh.
Okay, hello everybody. Nice to see you if you're out there. My name's John. I'm here with Lindsay. We both work with Lewermark, and we're your insurance provider while you're studying at Southeast Missouri State. So this isn't, I always say insurance is not the most exciting topic, but in the US, it's definitely an important topic. So I think somebody just started sharing their screen. So I'm going to
Yeah.
go ahead. Okay, thank you. But yeah, no, so insurance, not super interesting, not exciting, but it's very, very important. The reason we say that is healthcare in America is very complicated, it's expensive, and it takes a lot of knowledge and help to navigate our healthcare system. And where insurance steps in, of course, is paying for bills, helping you find doctors, making sure that you get the care you need, you have the questions you asked answered. That's what we're here for. So, what I'm going to do today, I'm going to take you through sort of the life cycle of what it's like to enroll in Lewermark, where you go from there. How do you understand the plan? How do you use the insurance? And of course, your resources that are available to you. So I'm going to go ahead, share my screen here. We're going to go directly to our website. There we go. Okay, so we're going to start right here. This is lure.com. This is where you're going to get everything you need to know about your insurance plan. A lot of you have already enrolled in the insurance, which is great. Um, but just for the example, we'll pretend that you just finished your enrollment. Where do you go? What do you do? How do you start accessing information? How do you use the insurance? So again, let's say you just paid your bill, you got the receipt, you're enrolled in coverage. As soon as you do that, you have an account that's created for you. So if it's your first time ever logging in, first time buying insurance, you will have an account created for you. You just have to go in and set it up. And where you're going to do that is right here on this student login button. So you're going to click here. And again, keeping to first time logging in, first time student, um, you're going to toggle this over to I need to create a login. With SEMO, I know y'all have an S at the beginning of your ID number. So you can just type it in as you see it on your student ID card with SEMO. But our system is going to correct that to a 0. So it'll change it over and it'll look like a 0. That's exactly what it's supposed to do. So don't get confused when it does that when you're logging in. The next step would just be entering your date of birth in the month, day, year format. That's your password for the first time you log in. So once you do all that, it's going to take you to another page where you have to set up some more information before you can access your account. And that's simply just making a new password and setting a security question. So once you've done all of that, you'll have full access to your account. You can access your insurance ID card. You can see claims on your profile. Claims are bills that providers send us for processing. So you can see where those are at on your profile and you can just see your information as we have it stored in our system, just to make sure everything looks correct. And of course, if you have any questions about that, I'm going to move on to where you would ask those questions. And by the way, too, I'll be presenting. I have Lindsay here with me. She's helping today. And if you have any questions while I'm presenting, you are more than welcome to throw it in the chat on Zoom, and Lindsay will be happy to answer those. Um, but for a more like general sake, like let's say we're not in orientation and you have a question about insurance. Right here, 3 great ways to get in touch with us. Kevin and I were literally just talking about how awesome the chat feature is. And that is probably my favorite way to get in touch with us because all you have to do is come down to this little orange button here in the corner. You just put in your information and you can speak with somebody immediately. Um, Again, it's immediate. It's a real person. It's not AI. It's not automated. Real person helping you here in our office uh, with your insurance questions or just healthcare questions in general. But of course, if you prefer to email or call us, you can do so as well. Our office hours are 8 a.m. to 5 p.m. Central Time, so we're in the same time zone. And I'm going to go ahead and back out here to our home page so we can look at your school page because it has a little more information about business hours there. So you'll just type in your school page. You know you're in the right spot. You see all of your info, or you see your logo right there for school. And then you're going to see all of your icons down here, which has the information for your insurance plan. Um, right here, just recapping, 8 a.m. to 5 p.m. Central Time. We're available during those times. If it comes in after hours, they'll typically be answered within the next 1 to 2 business days. If it's an emergency, we do monitor emails, voicemails, and chats after hours. So there is somebody looking at those, making sure that your question's answered or you get the help you need. So, but if it's a general question about maybe coverage or ID cards, that'll typically come within the next business day or two. And then here, our actual phone number and our actual email right there on your school page for you to access. Okay, so I'm going to scroll down here to these tiles. So you see a lot of stuff down here. I'm sure you've seen the purchase student insurance if you've already bought your coverage. Um, and then you have print your ID card right here. So this just takes you right back to the student login. And the reason it does that is that's where you get your insurance ID card. And the reason you're going to see this here and you see it on the home page is your insurance ID card is very important to have with you at all times. Every time you go to the doctor, the hospital, the pharmacy, they are going to ask to see a copy of that insurance ID card. And they do that so they know where to send the bill because they don't want to send it to you, they want to send it to us first. So, very important to keep that with you at all times. My recommendation is take a screenshot, save it to your phone. If you're anything like me, you don't go anywhere without your phone, so you'll have it with you wherever you go. I don't even keep mine in my wallet anymore because I lose my wallet all the time. So I just keep it on my phone. So print your ID card, very, very important. Over here, we're going to skip purchase student insurance, and we're going to go into sort of the understanding your plan part, essentially. So plan summary, plan brochure. It's going to have all the information about your plan. Plan brochure, I'll open this up. As you can see here, it's 31 pages long. This is every little benefit and detail imaginable about your plan. So if you are suffering from insomnia, you can read this and it will put you to sleep. But if you have any questions and you don't want to read through this, just remember our chat features right there in the corner. On the other hand, you have your plan summary. So whereas the plan brochure is 30 pages, your plan summary is only 1 page, and it's designed to summarize all of your main benefits right there, easy to read. So this is your plan summary, and I'm going to zoom in here just to make sure everybody can see this. And you'll see at the top here, it says 2024 through 2025. So your insurance plan runs with your school year, essentially. So August to July or August 15th to August 14th of the next year. So a lot of the benefits you'll see on here are for the year. So for example, I'm going to mute him. Thank you. For example, your plan has $500,000 of available coverage for the school year, and this resets every year. And you'll see it in other places as well, like on the COVID vaccine benefit and the wellness benefit. You see policy year, policy year. So that just means, again, that's for the school year. Every year it resets. We're going to go back up here. Annual deductible, you don't even have one, so we're not going to worry about what that means. It's zero. That's the best part about it. But down here, you'll see office and hospital and emergency room, and they all say in and out of network. And you may be wondering, what does that mean? What is in network? How do I find that? Those are all great questions, right? So a network is another unique part of US healthcare. Every insurance company has what's called a network, and it's essentially an agreement with doctors to provide better rates with your insurance. So in-network means your Lewermark or your Aetna insurance has an agreement with that doctor to provide you a better rate. So, for example, on office visits, meaning a place that's not connected to a hospital. So think of a primary care physician or maybe a specialist that's has their own standalone office that you're going to visit. Um, in-network physicians, doctors, facilities, all eligible services are paid at 100%. And then you would just have a $20 copay. And a copay is just a fee you pay each time you visit the doctor. So essentially, when you go to the doctor and it's a fully covered visit, you're only paying $20. For out of network, it's a little bit different. Remember, we're not getting that good contracted, negotiated rate with our insurance network. So it's 80% coverage, and then a $20 copay. So there's a little bit of a difference there. Of course, I'll show y'all how to find an in-network doctor versus an out-of-network doctor once we're done going over the plan summary. For hospital, very similar in-network, 100% coverage for eligible services, and then a $100 copay. So the copay is a little bit higher for hospitals, but again, most of the time we're going to an office, an urgent care, or walk-in clinic. We're not usually going to a hospital. For out of network, very similar, 80%, and then a $100 copay. For emergency room, you don't see any percentages there. Um, that's because you usually don't get to choose where you go in an emergency. So if the ambulance takes you somewhere, you can't say, take me to this hospital, it's in network. They're just going to take you to the closest place. So for emergency room, it's $100 copay in and out of network. Okay, so we've talked a lot about medical insurance benefits in and out of network. I just want to take a step back and kind of reiterate what this medical insurance is for. It's for accidents, injuries, illnesses. It's designed to cover those. Break your leg, got to go to the hospital. It's designed to cover that. Get the flu, get an ear infection, twist your ankle. It's designed for that. So it's designed for those accidents, injuries, or illnesses. But what about maybe an annual checkup, or maybe you need to get a vaccination or a TB test? Well, you have a benefit built in just for that. It's called the wellness benefit. So that covers 100% up to $300 per policy year. And remember, policy year is your school year. So each year you have $300 to use on your insurance for those annual physicals, vaccines, TB tests. I call this the non-injury illness benefit because it's for, continuing, keeping yourself healthy, seeing the doctor every year, making sure everything's good to go. I'm going to scroll down here to pharmacy. So this this is another interesting part of health insurance. Pharmacy benefits are usually separate. So you'll see here you have $2,500 per policy year just for your pharmacy benefit. And it says outpatient, which means a pharmacy at like a CVS, a Walgreens, a Walmart, a Target, any of those big box stores. This insurance will work there in their pharmacy. Those prescriptions are covered at 50%. Now, I'm going to add here another unique part of US healthcare is we have brand name medications and we have generic medications. So they're two types of medications. However, they do the same thing. They're the same drug, but one just has a brand name associated with it and one does not. Um, Brand names are very expensive. Generics are very inexpensive. And I always give my real world example when I went to the doctor and they prescribed me a brand name medication. It was going to be about $400 a month, but I got the generic version instead because I asked for it. I said, is there a generic version available? And that ended up being about $4 a month. So huge difference between the two. And you can always ask your doctor if they're prescribing you medication or the generic version if they have that available. So just keep that in mind when you go to the doctor. You can always say, I would like the generic version, because that'll help you save some money when you go pick up at the pharmacy. Okay, I'm going to scroll back up here to the top. Talked about copays, in network, out of network, all this stuff. But really, most important thing on here is you do have no cost options for you available in multiple places. So you'll see student health center, telehealth visits, CVS walk-in clinics, 100% coverage, and no copay. So these are wonderful places to start if you're just not sure what's going on, cold, flu, ear infection. Um, if you have any of those going on and you need to be seen, you have three resources available, one right on campus where you can be seen for free. Um, if it's something they can treat there, that's fantastic. That's exactly what it's designed for. But maybe if you require a little uh, higher level of care, maybe you need to see a specialist or go to the hospital, uh, they'll refer you as such. So what matters is in the first place, you got what you needed, a referral, or you got a prescription, or you got treatment for free. And that starts with your student health center, those CVS walk-in clinics and telehealth visits. Okay, I'm going to scroll back up here and we're going to go back to the home page or the school page for SEMO. And we're going to go over here to find or search for a doctor. So remember on our plan summary, we had in-network, out-of-network. How do you find those? Where do you go? What do you do? That's exactly what this button right here is for. So we'll hit search for a doctor and it's going to take us to this page. And you may be wondering what this is right here. So it says Aetna. It's a big magenta logo. This will be on your insurance cards as well. And this is your network. So Aetna is your network with Lewermark. Um, One of the first things that doctors or providers will ask you when you schedule an appointment or go see them in person is, do you have insurance? And the answer is yes, you have insurance. Um, and 99%, the next question is going to be, what is your network? And if they ask that, the answer is Aetna. Aetna is a massive company and they have agreements with doctors all over the US to provide you those better rates that we were talking about. So if they ask you what your insurance or your network is, you can just say Aetna, and your insurance card has the Aetna information on there for them to submit the bills. So just remember that Aetna is your network. But if we're looking for those Aetna providers, we'll just click on this button right here, find an Aetna provider, and it's going to take us directly to Aetna's website where we can search for doctors. And the example I I like to use is, you know, the insurance works across the US. So you're in Cape Girardeau right now, but what if you're on spring break and you're doing some shopping at uh, on Rodeo Drive in Beverly Hills, and you fall, you twist your ankle, and you're like, oh my goodness, where do I go? What do I do? Well, you just come on here, type in Beverly Hills. We'll see it right there. And your ankle has been twisted or it's sprained. So we don't want to walk too far. We can move this down just a little bit. 9 miles is still pretty far, but I think we can make it if we have to Uber. So we'll hit search here. And on this page, it's going to ask you to select a plan. Don't get confused by this. You have access to both of these networks. We just recommend you search the primary network first. So primary PPO network, and then you'll hit continue. Okay, so, ankle's been twisted. We're looking for urgent cares in Beverly Hills. What can you do? You have two options. You can go right here, you can type in urgent care and just see what comes up. Or if you just want to search by category, you can go down here and just type or click on this urgent care button. And this is going to pull up everybody in network in your area. It'll have their information, such as their address, their phone number, and most importantly, it'll have that big green check mark next to it and it says in network. So yeah, all their information's right there. So you can call ahead or you can find their address and get there as soon as possible to be seen. And it's not just urgent cares as well. You can do this for primary care doctors, for specialists, hospitals. It does facilities, doctors, it does everything. So you can search for just about any type of doctor or facility that is in network. If you do want to get a little more granular on your search, maybe you want to see a doctor that speaks French because that's your native language and it's easier for you to converse with that doctor in French. You can go on here and just select languages and click that and then find the nearest provider that speaks French. Okay. All right. So just to kind of recap where we've been so far. So we bought the insurance, we logged into our student account, downloaded our ID card, we read our plan summary to make sure we understand how our benefits work, we found a doctor, and we used the insurance. So where does it go from there? So the doctor will take, it's called a claim. They will take that and they'll send it to us. We will take that bill, we'll process it. If there's anything left over, such as the copay, we'll send that back to the provider and they would either send you the bill for the $20 or they would make you pay for that up front when you go visit them because your ID card does have your copay right there on the front of it. So again, claims are the bills that doctors send us for processing, and then we will send the payment back to the doctor once everything has been done on our end. Okay. So now I'm going to scroll down here. So we're going past these tiles. We're going to scroll down to this section here, and we're going to look at some things that are essentially, well, I call them the freebies because you get them on your plan, everybody gets them. Um, and if you remember on our plan summary, there were some low to no cost options such as student health center, CVS walk-in clinics. Those are places you can physically go to. But what about telehealth visits? How do you access that? So that's exactly what this is right here. It's called Teledoc. So this is an amazing service. I have used this a lot. It's fantastic. I don't have to get out of bed to use this. So let's say, it's the weekend, you're feeling sick, student health center is closed. You don't want to get up and go out anywhere. You can just pull out your phone and call a doctor right here on Teledoc. Um, and here's a list of things that some minor ailments that it's great for. Um, they can prescribe you medication over the phone, and then you can go pick it up at your local pharmacy. Um, this is just an app you download to your phone. Once you're registered with Lewermark, so you've bought and paid for your coverage, you get registered with Teladoc as well. So you can just download the app and then you'd register yourself on the Teladoc app and you can start using it immediately. And again, use this as much as you need to. It's free for you to use. So that's telehealth. But sometimes maybe we need a little bit of different type of support, maybe some mental health support. And y'all have gone on a long journey, maybe need somebody to talk to, other international students to discuss maybe homesickness or stress about finals, stress about the big adjustments you've been making. Uh, that's what Together All is for. So this works just like that. It's similar to Reddit. It's an anonymous platform. You can talk to other international students peer to peer, and you can talk about things that we just discussed. So stress about finals. Maybe you went through a breakup. Um, maybe you're a little homesick. You can talk with other students on here. It also does some other cool things. So like yoga routines and meal planning. I've used it for the meal planning. It's pretty cool. So there's a lot of stuff you can do on here. And all you have to know or do to register for this is your SEMO email. So if you know that, you've already figured it out. You can just hit this join for free button, and then you would use your SEMO student email and log in to this service. But what if maybe you need to talk to a professional? So maybe you're really homesick, you're really stressed about finals. Um, you just need a little higher level attention. This is where you can contact a mental health counselor. This is called TELUS Health, works very similar to Teladoc. It's a 24/7 service, one-on-one support with mental health counselors. They provide counselors available immediately in 5 languages, so English, Spanish, French, Mandarin, and Cantonese. Um, but if you prefer to speak to a counselor in a different language, you can set an appointment and they will find somebody who does speak that language. So they have a very diverse staff at TELUS Health, and they always find somebody to accommodate special requests. So you can make a request to see a counselor that speaks your native language. So the last two things, Togetherall and TELUS, Togetherall is kind of your tier one support. Talking with other students, just maybe getting some things off your chest. TELUS is a little higher level support, so speaking one-on-one with counselors. And then the highest level of support would be, of course, using your Lewermark plan, your actual medical benefits for mental health. Your plan does include that. So if you need to see somebody in person, have that one-on-one discussion in person, maybe set up a recurrence of appointments, you can do that with your Lewermark plan. It does provide that benefit for you. Each year you have 30 visits of in-person mental health treatment. So just keep that in mind. You have a lot of support here. You have 3 levels of support that go from speaking with students all the way up to seeing a professional in person that's local to you. Okay, the last thing I'm going to go over here um, is Scholastic Emergency Services. And this I think it's the most important one just because it's for the things that we don't think will ever happen to us. And when they do, or if they happen, it's important to have this service by your side to help pay for things, get things sorted out. So again, worst case scenarios is what this is designed for. So my example that I'll use is you get really sick while you're at SEMO. You go to the hospital, you've been in the hospital for a week and it doesn't look like you're going to be able to go back and study. You need to go home. You need somebody to come visit you. Who's going to pay for that and who's going to arrange all that? That's a great question, right? So that's exactly what this service will do. So if you're in the hospital, you need to go home, they will pay for you to travel home. If you need somebody to come visit you while you're here in the US in the hospital, they will pay for a family member to come visit you. If you can't travel by yourself because maybe you're so sick you have to have somebody go with you, they can pay for a medical escort to go with you. It also works with, let's say you have a death in your immediate family, and you need to go home and be with your family and grieve with them. They will pay for you to go home, be with your family, attend your family member's funeral, spend time with them, and then they will pay for you to fly back to SEMO. So this, again, is a fantastic service. If y'all are on your phones or on your computer, take a screenshot of this right here. Just save it somewhere. Send this number back home uh, to your mom or dad so they have it as well. Um, and then, of course, this would be the inside the US number. And I say this, let your family know that you have this, it's available. Because if anything happens, this should be one of your first calls that you make. Uh, and I say that because they don't work on a reimbursement basis, meaning if something happens and people start paying for flights, making arrangements, they are not going to pay you back. So again, share that number with somebody back home. And just remember you have a lot of resources outside of your insurance plan available to you. You know, you have Kevin, you have me, you have Lindsay. If something happens, we can call on your behalf to the service and get something set up. So it's very important to know about this. If you have any questions, always reach out to us. But yep, just remember that you have this service available to you. Okay, so I've covered a lot of stuff, and I've seen some questions pop up in the chat. Um, does anybody have any questions at this time? You feel free to come off mute and ask away. No questions. Hmm. So I must be doing a really good job then. That's okay. If y'all think of something later, you can always reach out to us. I do want to cover one more thing, not insurance related. You may have seen this on the homepage right here. Might be wondering, what in the world is an insurance company doing offering a scholarship? That's a great question. So we have a scholarship every fall and spring for international students only. These are fun. They're not typical scholarships. So, you know, it's not write a 13-page essay about Western European politics in the 16th century. This is like, you know, if you're a superhero, what would your superpower be? You can write poems, short stories, you can make videos, paintings, you can do whatever you want, essentially. I'm not sure what the prompt is going to be for this fall, but I know it's coming out soon. So just check back on the website and be on the lookout for the fall 24 scholarship. And then if you happen to be a winner for fall 24, that money will go towards your spring tuition. So um, yeah, feel free to participate. We love it when you do. And I think we had a lot of SEMO submissions last year. So yeah, just be on the lookout. Feel free to join in, and we'll be excited to see what y'all submit. Other than that, Kevin, do you have anything to add?
I have some things to add. I think you all did a great job of covering everything. Again, any questions out there? I always want, you addressed it pretty much, but I always want students to know if I'm not feeling well, what should I do? What are the steps that I need to take? And as you mentioned, now the telehealth is a great option. The student clinic is a really good option. I don't know, did you say anything about when to possibly use the emergency room compared to other options?
No, and I'm glad you brought that up. Thank you. That so Kevin's asking about when to use the emergency room versus the student health center. So this is kind of another unique part of U.S. healthcare. We have a very structured system, so it's very delimited essentially. And a lot of different places across the world, the only place you can really go is the hospital for any sort of care. But in the US, the hospital is for very severe incidents, emergencies, um, things that absolutely cannot wait or that you need to be taken to in an ambulance. So if, let's say, you twist your ankle, it it hurts really bad. You can still walk on it a little bit. That's something you would not need to go to the hospital for. That's what urgent cares are for, or walk-in clinics. They can treat those there. If it's I cut my hand open while I was peeling oranges or something and I'm bleeding everywhere, that is 100% a hospital visit. So uh, I always say hospital is something that cannot wait. Go there in emergencies. But if it can wait and you're just not sure, start with the student health center, because if you're not sure and you go to the emergency room, they're going to make you wait a long, long time if it's not an emergency. So we've heard stories of students waiting 7, 8 hours in the emergency room for minor visits. But if it is an emergency, you will be seen very quickly at the emergency room.
Yeah, good. And I would also tell everybody too that the campus health clinic can get very busy. And if you just try to walk in there and don't have an appointment, they do not always serve just as a walk-in clinic or somebody that can see you immediately. So it's in your best interest to call them beforehand to see if you need to make an appointment or if you can just come straight in there. Because sometimes people get confused. They go in there and they say, "We can't see you today because they're too busy." In the student's mind sometime that thinks, oh, my insurance doesn't work here or I'm not eligible to go here. It's usually more a matter of do they have the ability and the time to get you in and have one of their practitioners see you that day. So please try to call ahead of time to that the campus health clinic if you can. Um, I think another thing that you did well in addressing, sometimes people think that if I'm paying for insurance, I won't have any out-of-pocket expenses. And really that's not the case. And insurance does cover a lot of things, but most often I think it's a high percentage of what you have that you still may have some out-of-pocket expenses with insurance, just not nearly as much as you'd be facing if you didn't have any insurance. So insurance is really just a way to protect you financially. It's not necessarily something that's going to cover every single expense you have in relation to an illness or a problem you have. And then the other things that I really want to stress to all of our students too is, that teledoc, you don't have to get out of bed. It's really simple. I've used it. My family uses it quite a bit. It's really good for getting prescriptions for something. They can diagnose things over the phone with a good camera and things like that. So that is a real nice, convenient option. And John, in Teladoc, is there any copay or anything, or it's straight across the board, no cost associated with it?
For all SEMO international students enrolled in Lewermark, it is a free
Okay,
service. They can use it as much as they'd like to, and they don't have to pay for visits using Teladoc.
okay. And I was not aware of the Connect Us or what's the one where you're meeting with other kind of works like Reddit, you said,
Oh, Together All?
together all. So that's a great option just to kind of connect with other people, talk about things, share your experiences, and then of course the tell us health, the mental health thing, an amazing service that I talked to everybody during our new international student orientation about the challenges of being in a new place and culture shock and going through stressful environments and changing weather and not acclimated to the food and language and things like that. Talking to a professional, getting a framework of understanding is so important in helping you move forward and to learn. And that TELUS service is phenomenal. As they said, it's multilingual. You can talk to somebody from your own country and in your own native language. Really recommend taking advantage of these opportunities that you're already paying for to help you be successful here. So I'm thrilled with our partnership with Lewermark. I know that our coverage is about $125 a month, and I know that that's a big expense for a lot of people, but it is absolutely essential. I know you get a lot out of it. I also know that other students at a lot of other institutions pay a lot higher for their insurance than we do here. So comparatively, this is a lower cost. And I promise you, in all my years working with Lewermark, I've always found them to be fair. I've always found them to have exceptional customer service, polite and respectful. And we really value our partnership with Lewermark, and we're happy that you're now working with them too. So um, that's all I have to say.
Awesome. Well, yeah, thanks, Kevin, for emphasizing those points. Like, this is such an important thing to know about. Again, not the most fun thing to know about, but it's very important. the last thing, I'll say is, Lindsay and I are on the call together, but there are several other people. I'm looking across the office right now. I see all these other people helping students right now, so they're available to help you as well. Just remember that chat feature. You can call us, you can email us. We're always happy to help you. And we hope you have a wonderful fall semester. And again, be on the lookout for the scholarship. We'll have some more updates for that soon.
And we'll be sure to share that too once you have it available. So,
Absolutely.
all right. Well, thank you both. Have a
Yeah,
good day,
thank you.
everybody.
You guys have a great semester.
All right. Thanks. Bye.